We were going through a COVID surge, we had inadequate staff, and we really felt we needed to add an extra layer of support. So we looked at all of the different technologies that we already had at Atrium Health. Through technology, we were able to provide another layer of care, not to substitute for the bedside nurse, but another additional layer of patient care. My name is Maureen Swick. I am Atrium Health's Enterprise Nurse Executive. I am responsible for nursing practice policy research across the entire enterprise for Atrium Health. I have been a nurse for 39 years. I have been in a variety of different position roles, but gravitated very early on in my career, 2 years into nursing leadership positions. The Virtual Nurse Observation Program is a new care delivery model. It is a program that was developed between the bedside clinical staff and our nursing leadership team. It is to add an additional layer of support for our nursing clinical teams by having an experienced nurse who sits remotely behind a camera to add that additional layer of support for patient care as well as our nursing team. The Virtual Nurse Observation Program has that nurse sitting behind the camera, so they're able to observe a patient, they're able to see their vital signs and anything else that may be going on with the patient. We really wanted to find a way that minimized the amount of times our nursing clinical team needed to go in and out of COVID's patients' rooms. We knew that these patients were acutely ill, they needed constant observation. But it took a lot of time for a clinical team to doff and don their protective wear. By having the camera in the room at all times, it minimized the amount of times our nursing team had to go in and out of the room. As we began to implement the Virtual Nurse Observation Program, it was really important that we stayed close with the entire team. So we would meet weekly to evaluate how the program was working, were there any problems or issues that were popping up. I can honestly say we didn't hit a lot of obstacles. It was more of just working through some of the issues about what should the core competencies be for this experienced nurse behind the camera. We thought it was really important that this nurse have many years of experience, at least 5 years of clinical experience, preferably progressive care, so that they would be those extra set of experienced eyes. What also came out of that was we were able to pull nurses that were potentially thinking about retirement that could no longer do the bedside to be our virtual nurse observers. So that was a win-win for us to be able to keep those experienced nurses close to the bedside. For the Virtual Nurse Observation pilot, we tracked patient experience, and the feedback was incredibly positive from the patients. They felt extremely safe. They felt like they always had somebody right there at their bedside that they could ask a question of. The teaching that went on between the virtual nurse and the patient and their families was available at any time that they needed it. For the last 2+ years, we've all been faceless with our patients. And I think to have this virtual nurse be the face for that patient is really very powerful and something that our patients have commented on, because so many people go in and out of our rooms, right? And everybody's wearing a mask, and it's really hard sometimes to make that connection. You wouldn't think that the virtual nurse actually brought humanity to the bedside, because that nurse's face was the only face that that patient saw during their entire hospital stay. The Virtual Nurse Observation Program has been expressed across the entire enterprise with our nurse leaders. They're really excited about it, especially since they've heard directly from their own colleagues and peers about what a positive thing it was. And I can tell you too, for the new graduates on the floors, I think this will really help us from a recruitment standpoint and retention because they know they will have that additional support 24/7. Again, another unintended positive from the virtual nurse observation program was the fact that we were able to keep some of our nurses who just could not do the physical work at the bedside but had multiple years of incredible experience, clinical experience, able to keep them as part of our clinical team through this program. If I could give any other healthcare executives advice on how to get a program like the Virtual Nurse Observation Program set up, and set up quickly, it would be by pulling key stakeholders together, such as your IT leadership team, your clinical nursing team, and physicians and other key disciplines as part of the care team, and making sure that a good evaluation is done across your system about what existing technology is there in place that's already interfaced with our EMR that could be utilized into helping us to develop a program like the Virtual Nurse Observation Program. And also key is selecting a unit or an area where your team and your leadership team are open and willing to change management because this is a different way of delivering care for our patients.